The representative from Connecticut, Mr. Courtney, is recognized for 5 minutes.
Thank you, Mr. Chair, and thank you to the panel for being here today on such an important topic. I appreciate the opportunity getting waved in as not a sitting member of this subcommittee. I used to be on this subcommittee, as Mr. Barra remembers. And I did want to just, as long as we're talking about OSHA priorities, and I think Mr. Scott alluded to this earlier, is that, one of the I think most urgent issues before OSHA and Congress is the crisis that exists in our healthcare sector. Again, 2016, we had a GAO report which showed that people who work in hospitals, nursing homes, EMTs, ride in ambulances are subject to workplace violence at a rate of 5 times greater than any other sector in the U.S. economy. We had a horrible tragedy in my district in Eastern Connecticut last year, where a home health nurse went into a home. Again, it was an individual that was on the sex offender list, and she never emerged after it. 56 years old, large family, heart of gold. And unfortunately, that's not a rare instance. The numbers that GAO produced in terms of kicking, hitting, spitting, and actual violence with weapons is something that happens far too often in emergency rooms, psychiatric hospitals, and again, the folks who ride the ambulances, particularly on overdose situations where, again, they are subject to workplace violence. So, Mr. Barab, there's a pending rule that has been excruciatingly slowly moving forward, which would put in a workplace violence prevention standard. It has been scrubbed in terms of the financial cost. It is a fraction, tiny fraction of the overhead of healthcare institutions. Again, and this would be aimed at really just putting into place common sense preventative measures, which have been shown to work in other parts of the country. OSHA has set up voluntary guidelines to make that, to at least give people best practices out there to stop this epidemic of harm and violence. But again, we're still sort of just moving along at a snail's pace. We have legislation to accelerate that process. There's precedent for it when the AIDS crisis hit. And again, people were subject to bloodborne pathogens. And this happened again in first responders as much as any other population out there. Congress forced the process to move forward to put into place the standards that today include gloves, disposable needles, all the things that have worked to prevent the spread of AIDS. So again, can you, just talk about, this priority, which is in the pipeline, but, just inching along, and how this is a way Congress can actually save the lives of nurses, emergency room physicians, again, the healthcare providers, 15 million strong in this country, who, again, are subject to an unacceptable level of violence that is burning out staff and making it harder to recruit people into the field.
Yeah, thank you for that question, Mr. Courtney, and I commend you for your leadership on this issue. I have been working on the issue of workplace violence for 40 years. I used to work for a union that represented healthcare workers and social service workers. It's always been a terrible problem. We had a struggle to get OSHA to try to address it, which they finally did in the 1990s. And as you say, they've been making frustratingly slow progress on a workplace violence standard, despite the fact, again, that this chamber has passed legislation twice on a bipartisan basis to force OSHA to issue that standard much more quickly. OSHA standards, this standard and other standards, are not just based on somebody sitting in a little office across the mall. They are based on what is going on, what the best employers are now doing to prevent workplace violence in their workplaces. These measures that OSHA will require work. They're feasible. They save lives, and the sooner OSHA can get that standard out, the more lives that will be saved.
Thank you. And again, as you point out, this is something that is in place in some healthcare systems, and it's showing great results. And we're talking about simple things like flagging high-risk individuals. The case that happened in my district, someone being on a sex offender list, she never should have been going into that home alone. Mm-hmm. And, having, again, that sort of flagging system and a communication system, and also learning how to sort of address and mitigate and respond and control violence and aggressive behavior works. in terms of saving lives. So again, I thank you for clarifying that issue, and hopefully we'll pass the bill. Mr. Bacon, Republican, is the lead sponsor in this Congress. It would pass. There's just no question about it, and we can actually do something to help the caregivers of our nation. I yield back.
Thank you. The gentleman's time has expired.